This video has to do with post-operative instructions after a sinus lift procedure. So you're either about to have a sinus lift or are done with the sinus lift procedure, and I know things will work out for you, especially if you listen to these instructions. So a sinus lift procedure is a procedure where we gently lift the sinus membrane and put bone graft. So a big part of that procedure is not to disrupt the healing that's taking place. And the main way that this can be disrupted is via pressure. So we want to avoid anything that creates pressure inside the sinuses. That includes any type of sneezing when we pinch or we blow our nose forcefully. So we need to avoid these activities. Other things may include drinking through a straw. We do not want to do that. We don't want to be blowing up balloons at kids' parties, so avoid that too. Anything that increases pressure here needs to be avoided. For how long? For at least 3 to 4 weeks. So we have to be very, very gentle with that. Things to be also mindful about is diet. For the first week, we like to stick with cold and soft diet. Nothing crunchy, nothing spicy, nothing hard, nothing that can puncture or injure the area. So we avoid anything like chips or nachos or seeds or anything of that nature. Expect after this procedure mild to moderate swelling. Most of the swelling will occur up until day 3. In order to minimize and moderate that type of swelling, you want to be applying ice 10 minutes on and 10 minutes off on the area for the first 2 to 3 days after the procedure. Maybe also consider sleeping with your head propped up. So that's one thing to expect, mild to moderate swelling. Another thing to expect is some minor oozing from the mouth or the nose. Don't be alarmed if you have a minor nosebleed. It's part of the healing process, especially because we're lifting that membrane, and that membrane does have blood vessels. So these are things to expect. Things that should alarm us and things that you need to notify us about include, after day 3, increasing facial pain and swelling. We need to know about that. That may be a sign of infection. Systemic symptoms that may include fever, chills, and fatigue. We would like to know about that. We want to make sure that these are not signs of infection, and we need to be able to intercept that early enough and not have any problems. Especially if you get a feeling of flow of air between your nose and your mouth. That may be something that you'd like to notify us about. Please do. That may indicate there may be a small communication between the mouth and the sinus. We would like to know about that. So these are things that please keep in mind and let us know if that happens. Anything else that you're unsure about, it's better for us to know that and guide you appropriately than us not knowing. So again, avoid pressure, do not vape, do not smoke, do not put any sharp things in your mouth, avoid any heat for the first few days, and of course avoid putting your fingers or your tongue on that particular area. Your doctor will also instruct you, in case you have a removable appliance, to avoid wearing it unless you were given different instructions. As far as medications go, please do take your medication regimen as prescribed. That typically includes antibiotics. So antibiotics as prescribed. If you have been prescribed a mouthwash, we do not always prescribe mouthwash, but if you have been prescribed a mouthwash, please use it as the doctor has instructed you. Particularly, avoid swishing forcefully with that mouthwash. Just keep it in your mouth and let it drip down. We don't want any forceful movement in the mouth, because that increases again the pressure that we're trying to avoid in the sinuses. By following all these instructions, I think you will find that you will have an uneventful healing and we will have a successful sinus graft. For anything that you're unsure about, we're always here for you. Please call us and we will get in touch with you immediately and answer those very questions. And if we have to see you, of course we will see you as part of our rigorous follow-up care so we can have a successful result. Thank you so much. I'm Dr. Dounis and looking forward to seeing you.